It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: worms and parasites found in dogs. All dogs get intestinal parasites, so it's important to talk to your veterinarian about diagnosing, treating, and preventing worms. In this video we will talk about the most common intestinal parasites and protozoa seen in dogs. 1. Intestinal worms. They are long white or light brown worms that live in the intestinal tract and are visible in your dog's stool. Adult pets contract roundworms by ingesting roundworm larvae found in infected feces or contaminated soil. Puppies contract intestinal worms from their mother's uterus or from their mother's mammary tissue. Signs and symptoms: diarrhea, worms visible in feces, vomiting, cough, pot-bellied appearance, weight loss. 2. Hookworms. Hookworms are another common intestinal parasite of dogs. They attach to the intestinal wall with sharp teeth and suck its blood. Hookworms are much smaller and are not visible in your pet's stool. Adult pets contract hookworms from contact with contaminated soil. The larval stage of the soil-dwelling worm can penetrate your pet's skin or paw pads. Signs and symptoms: diarrhea, sometimes bloody, weight loss, weakness and lethargy, pale mucous membranes, anemia. 3. Tapeworms. Tapeworms are long, flat worms that attach to the small intestine of their host. Although tapeworms are long, white worms, they are made up of segments called proglottids. It is the proglottids that are often shed and visible in your pet's feces. Adult dogs and puppies acquire tapeworms by ingesting fleas infected with larvae. Signs and symptoms: rice-like segments around the rectum, weight loss, patina, fleas. 4. Whipworms. Whipworms are smaller than roundworms and are rarely visible in your dog's stool. These worms have a wide body and a narrow whip-like head. Whipworms live in the large intestine and, like hookworms, suck blood from their host. Dogs get whipworms by ingesting infected eggs that live in the soil. Signs and symptoms: diarrhea, chronic diarrhea, diarrhea with blood, anemia, electrolyte abnormalities. 5. The Giardia. Giardia are single-celled parasites that live in your pet's intestines. There are several genotypes of Giardia. Dogs usually contract type C and D. Giardia infects both adult dogs and puppies, but the disease is more common in young animals. Signs and symptoms: no symptoms. Many pets show no symptoms of infection. Chronic or intermittent diarrhea, weight loss, bad general state, fatty stools, sometimes blood in the stool, occasional vomiting. 6. Coxidia. Coxidia are single-celled organisms, protozoa, that live in your dog's intestines. There are many different types, but dogs commonly contract Isospora canis. Signs and symptoms: mucoid watery diarrhea, sometimes explosive diarrhea, lethargy and dehydration, abdominal pain, a poor general condition that can be debilitating, loss of appetite, vomiting. What should you do if you think your dog has worms? Call your veterinarian's office if you ever see worms in your dog's stool or suspect your pet may be infected with parasites. Your veterinarian should examine your pet and evaluate a fecal sample under a microscope. Once your veterinarian determines the type of intestinal parasite, he or she will administer the appropriate dewormer or antibiotic. Other treatments may be needed, such as medications for diarrhea, vomiting, dehydration, or anemia. Remember that it is easy to prevent common intestinal parasites by administering a monthly heartworm preventative that also prevents intestinal worms. Ask your veterinarian what the appropriate prevention is for your dog. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.